Hey everybody, Dr. C here with Zulu Time episode number 152. And today we're going to be talking about polycystic ovarian syndrome and diabetes and what does it have to do with diabetes. We've been talking in the diabetes series about all of the different complications of diabetes. We talk about how diabetes affects the whole body, places where the small vessels go and places where the large vessels go, and then other complications of diabetes. And today we're going to be talking about polycystic ovarian syndrome. So, how do you know if you have polycystic ovarian syndrome? There is mainly three things that actually qualify somebody to have polycystic ovarian syndrome, and those are irregular menstrual period, androgen excess, meaning like they have hair in a male pattern hair or male baldness or any type of the masculine characteristics. And then the third thing is actually polycystic ovaries on ultrasound. So those are the three things that actually qualify somebody to have polycystic ovarian syndrome. But what are the actual symptoms? Well, people have irregular menstrual periods, irregular ovulation, infertility, acne, male pattern baldness, depression, excessive hair growth, excessive acne, masculine features. And so these are some of the symptoms that happen. Why is it so important with diabetes? Because it is pretty intermingled. If you have polycystic ovarian syndrome, it actually puts you at risk of diabetes by 3 to 5 fold. Um, and so, what else do you find with polycystic ovarian syndrome? You actually find the ultrasound, you find the many polycystic ovaries. You also find elevated levels of hormones in the body, like luteinizing hormone, and you also find elevated levels of cholesterol. Um, of testosterone, sorry, of testosterone. And so, how does this testosterone happen? Well, it's actually the estrogen and the fat makes it turn into, through different, more complicated processes, ends up creating testosterone. And the way that the insulin resistance affects the brain, it actually results in testosterone, high testosterone levels, which lead to the hair, the facial hair, the acne, the male pattern baldness in females. And so it is really important to understand the interrelatedness between type 2 diabetes and polycystic ovarian syndrome, because many of the women that have polycystic ovarian syndrome have actually a lot of the same characteristics as people who have type 2 diabetes, women who have type 2 diabetes. And these are like cholesterol, high blood pressure, elevated blood pressure. They have elevated insulin resistance. They have um, I already mentioned the high cholesterol, the elevated blood pressure, the insulin resistance, the gain gain weight. All these things are associated the same with type 2 diabetics as with people who have polycystic ovarian syndrome. So it's really interesting to look at that. As to how do you treat it, well, if it just depends who you ask, right? There are medications that you can treat, and some of them help for different reasons. For instance, they use contraceptives to decrease some of the hormones, like luteinizing hormones. They use more metformin, which decreases the insulin resistance. They use estrogen modulators like clomiphene. All these medications, of course, have side effects. And also, it's important to think that a lot of this medication might not be getting to the root of the issue. Obesity definitely has a big part in this. Insulin resistance has a big part in this. And it's interesting to see why some studies show early evidence that approaches such as fasting could actually have an increase in increase chances of people actually overcoming this issue. And if somebody gets rid of their type 2 diabetes through weight loss, is showing that actually a lot of the symptoms through uh, that were there through polycystic ovarian syndrome are actually gone by then. So that's it for today. Today we talked about polycystic ovarian syndrome and how it relates to diabetes. So if you know of anybody who has polycystic ovarian syndrome, definitely share, comment, let us know if you guys have any questions about this, and if you want us to discuss anything related to diabetes in the future episodes in this diabetes series. All right, everybody. Until next time, Dr. Z here, and take it easy.